There are a number of guidelines. One is that when we want to give our expertise or advice or information, we always ask permission. It's before we tell the client about what we'd like to say. So one might say, would you like to learn more about the aids that are out there for smoking cessation? And if the client says yes, then the doctor would go ahead and give that information and then ask for feedback, what the client thinks about it. That's also a process. However, any information imparted, one always asks permission, and one always gives the client the opportunity to accept or reject or give feedback about that information. Then there is a process called elicit-provide-elicit, which is a comfortable way to give advice, to give information, to talk about medications, to talk about various treatments. And rather than heading right into it with, one thing that works for a lot of people are therapy groups and, particularly around trauma, if one's been traumatized before, rather than saying that, one wants to find out, what does this client already know about this? So that I'm not going to repeat. I'll give them stuff they don't know. So one might say, what do you know about, addressing the traumas that you've had in your life, the kinds of things that people may do to get help for that? And the client might answer, I really don't know very much. I've just started to talk about it, and I don't really know what to do about it. And so that would be eliciting. And then the psychiatrist would provide and say, would you like to know how some people work on this and what's been helpful for other people? And then when the client says yes, then the psychiatrist provides. There are groups for people who have been traumatized that provide a support network, a safe place to talk about it. There are therapies like cognitive behavioral therapy that help you to, track the way you're thinking about it, that might change the way you think about it to make that useful, et cetera, et cetera. There are medications that might be useful for times when you get very depressed, et cetera. And so that would be the providing part. And one might give pamphlets, et cetera, along with the discussion. And then one elicits again. What do you think would be good in your case? Or how do you see any of that working for you? Okay, and that would be one manner in which the psychiatrist would provide information, expertise, without simply telling, without being authoritarian, and with maintaining the partnership and the collaboration. In addition to one following the client, listening, giving reflective feedback, and developing a collaborative partnership, motivational interviewing is also directive. Here, the psychiatrist, the provider, is really facilitating movement along a change process that may be beneficial for the client. However, we still need to evoke and elicit why it's beneficial to the client, not why we think it's beneficial, but why it's beneficial to the client for their lifestyle, for their well-being. And once we have that rolling, we begin to become more directive. And the directive element would be what we attend to. So if a client's talking about what we call sustained talk, things are okay the way they are. I mean, my life is good. Why rock the boat? Let me just leave it like this. So one would have to reflect that they hear that and say, so what I'm hearing is that, it may be too much trouble for you to try to change this around or something like that. But on the other hand, one is not going to embellish or elaborate on the sustained talk, and one wants to put more attention toward the change talk. So that's being directive. So I'm going to give very little attention to the sustained talk and more attention, and I'm going to try to perhaps elicit change talk as well. So I might say after that, is there anything at all that concerns you about this, if you left it this way? And if I pick up a little nibble of anything, I've got change talk, if I get any kind of an answer. And then I can begin to move into the reasons why to change area. I'm being directive here. I'm playing down one side and I'm elaborating and eliciting on the other. on the change part, so that this is happening simultaneously. I'm following the client, but simultaneously I'm also being directive in facilitating not necessarily what they do, but facilitating their exploration of all of the elements around this behavior or around this change process so that they can make a real informed decision. And that is the right of every client, that they have the ability and the voice to make an informed decision about how they want to proceed, where they want their life to go, and how they want to live their life. And that's why the part of the physician's expertise and information is very important, because that information needs to be part of the decision-making process.